Hi, I'm Dr. David Cheng. In this segment, we'll be talking about breathing-related issue in your sleep. Breathing-related issue in your sleep can cause a major problem for your cardiovascular system in the long run, and also can impair your everyday function by not having enough energy and being fatigued all the time. There are 5 major types of sleep disorder: sleep apnea, narcolepsy, restless leg syndrome, insomnia, and REM sleep breathing disorder. In this segment, we're going to be concentrating on sleep apnea. But before we get to what sleep apnea is, we like to familiarize ourselves with some terminology so we can understand sleep apnea better. What is apnea? Apnea essentially means that there's a temporary stoppage of breathing. What is hypopnea? Hypopnea means there's a partial blockage of the airway so that only part of the airway is being let in and out. What is sleep apnea? Sleep apnea means there's a temporary stoppage of breathing while you sleep. As you can see from the flow chart or the algorithm, sleep apnea is only part of the sleep-related breathing disorder, but it affects about a quarter of the population. There are 3 types of sleep apnea: central, obstructive, and complex. The complex is a mixture of central and obstructive sleep apnea together. For obstructive sleep apnea, we'll be looking at how do you measure it, what are the symptoms associated with it, what are the general risk factors, what are the dental risk factors, what are the complications if no treatment is rendered, what are the treatment available, what are the long-term consequences of those treatments, and what are the alternate treatment, if any. The definition for apnea is that there is a cessation of breathing for greater than 10 seconds. And the definition for hypopnea is that there's a 50% decrease in the airflow accompanied by 4% desaturation of the oxygen level and accompanied by sympathetic arousal. The sleep physician will diagnose sleep apnea with the use of polysomnogram. Polysomnogram is done at a sleep center. The polysomnogram measures the number of apnea, hypopnea events throughout the sleep and calculates the average per hour of the apnea and hypopnea event. What are the common symptoms of sleep apnea? Snoring is one of them. In 80% of the people who snore, some study indicates that they do have obstructive sleep apnea. General fatigue would be another one. Excessive daytime sleepiness, morning headaches, and also hyperirritable in the morning. What are the risk factors for sleep apnea? Age. As we age, the muscle tones are going to be a lot more flaccid, therefore they're more likely to fall into a compromised airway. Male are more likely to have sleep apnea issues versus female. If you have a neck size greater than 17 inches for a male and 15 inches for a female, you're more likely to have sleep apnea. If you're a smoker and you're a drinker, you're more likely to have sleep apnea issue. Deviated septum. If you have deviated nasal septum, you're more likely to have issues with sleep apnea as well. If you sleep on your stomach or on the side, you probably have a compromised airway and therefore you have a sleep apnea issue as well. Hypertension. Hypertension could be a result of sleep apnea already, so that would be an indication that you may have sleep apnea. What are the dental risk factors for sleep apnea? If you have an upper and lower arch that is not well coordinated, in other words, the lower arch is a lot more behind compared to the top arch. If you have a narrow upper and lower arch, if you have an enlarged tongue, if you have bony exotosis or tora in the palate, if you have bruxism, if you have orofacial pain, if you have a tongue tie, and if you have the position of the tongue below relative in the mouth. The medical complications of sleep apneas are inflammations, hypertension, cardiac arrhythmias, stroke, congestive heart failure, cardiovascular disease, as a whole, insulin resistance, memory, learning impairment as well. The dental complications of sleep apnea has been discussed in part 1 of the Airway video. It affects all part of the oral cavity. First of all, it affects the tooth structure, which is from erosion from gut. It affects the TMJ and the muscles from bruxing, and also the tooth structure could fracture because of bruxing, and the root can fracture because of bruxing as well. And then, of course, the inflammation on the gum and bone. Its benefit is well documented for the last 20 years. It improves the patient's quality of life. It improves the cardiovascular status of the patient. The long-term use of CPAP does pose some side effects. For example, scarring from the mask on the face, a dry nose, dry throat, dry mouth, can cause entrapment of air in the stomach, and can cause discomfort or pain in the middle ear, and it can cause hypoplasia or the impediment or the retardment of the midfacial growth, especially in young patients. Moderate sleep apnea cases, sleep appliance can be used. Sleep appliance or sleep apnea, mouth guard, or OAT, or occlusal appliance therapy, they all mean the same thing. What it does is that it helps to move the lower jaw forward so it can keep the tongue out of the way so the airway can be opened up. In studies shows that sleep appliance can be as effective as CPAP in moderate cases. The use of sleep appliance can also pose some problem. For example, it could cause irritation on the gum, it could cause changes in the bite, it could cause looseness on the teeth, it could cause TMJ and muscle pain, it could cause excessive salivation, dryness in the mouth. What are the alternatives to CPAP? One could be lifestyle changes in terms of alcohol and smoking consumption. The other one could be looking at possibly doing maxillary and mandibular advancement surgery where you have the lower and upper jaw move forward so that the tongue can come forward with it. The other one could be upper airway resistance syndrome cases, could be where you could use a rapid palatal expander, which is to expand the upper arches out so the tongue can have more space in the mouth instead of being pushed back. The other one could be weight loss, exercises. However, with all those alternate treatment, you also need to be monitored by a sleep physician as to the status of your AHI score, because that's the only way that you're going to be able to tell whatever the treatment you have rendered or has been rendered that it's actually effective. Sleep apnea, more specifically obstructive sleep apnea, which we have been discussing so far, is the end stage of a sleep-related breathing disorder. However, we didn't get to the end stage by not having a beginning. So beginning, when we go back to it, we could be looking at snoring, moving on to upper airway resistance, moving into hypopneas, and moving into eventually into obstructive sleep apnea. However, even before that, we may want to go back and look at it. How did we get to that stage? Did we have a nasal obstruction when we were very young? Did we have a tough time breathing through our nose? Did we have an upper arch that is very narrowed? Did we have a lower arch that is much more further behind relatively in terms of the growth? And we also have to look at where's the tongue position? Do you have a tongue tie? So those are all the questions that we could look at it way ahead of time before we can try to avoid or avert all this sleep apnea issue at the end. Many of us may be unaware of the sleep apnea issues we may have. We tend to always blame it on, for example, late parties and stuff like that. However, you can use a stop bank questionnaire to actually have a look at what's the status of if you have any sleep apnea. And the stop bank questionnaire is available on the web that you can download, or you can look at it and calculate your own score. This brings us to the conclusion of our discussion on sleep apnea. Sleep apnea is a fairly complex and evolving subject. We can use screening tools such as stop bank questionnaires and high-resolution pulse oximeter to intervene earlier in the sleep-related breathing disorder spectrum so that we can avoid the end stage of the severe sleep apnea. Thank you for watching, and if you have any questions, please contact us at www.drchangs.com.